The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees. Now, time for a break with Central Illinois' own Gretchen Wirtz.
Welcome back to Central Illinois Newsday. I'm Gretchen Wirtz, and today we're talking about some alternative health options. We are with Springfield Clinic, and we've talked to them before, but today we are joined by Dr. Nani Moazam. I think I got it right. Close enough. Dr. Nani is in Pekin. Dr. Nani, thank you so much for joining us here today.
Thank you for having me.
So tell us a little bit about your scope of practice there in Pekin.
Yeah, so Pekin, we've had the luxury of being able to do just about anything surgical because patients come here and this is sort of the last stop for many of them. So we really do have the full gamut of surgical services here. We've also had the luxury that if we feel a patient could benefit from some of the services available at the Peoria campuses, we can have the patient transferred there. So we really do, colon surgery and gallbladder surgery and hernias and breast cancer and so forth here. But then again, if there's some reason that we need their help, that's been a real asset to have the Peoria campus so close by.
Very good. Okay. Now, Dr. Nani, I've heard that this is gallbladder season. Explain what that means exactly.
So typically gallbladder disease is associated with our access to delicious, wonderful holiday type foods.
That's what I was thinking.
Yeah. So it's, it's not just the obvious greasy fried fast foods that we think of, but it's also the very rich, dairy-based butter and other foods that we enjoy over the holidays. So we typically do see a huge uptick in gallbladder disease over, especially this Thanksgiving, Christmas, New Year, all close together.
So then maybe a little bit right after the holidays, you guys kind of get a lot of visits. So what can people do to maybe avoid you? I mean, what's the best thing to do over the holidays? Probably avoid all that good stuff, but that's not going to happen.
Yeah. So, one thing to appreciate that, unlike appendicitis, that, you don't typically get it over and over. You get it and we take care of it and it's a one-shot deal. Gallbladder trouble, it doesn't force you to have surgery. It just is a reminder, a check engine sign saying, hey, kind of don't have so much rich foods all in one meal, and that's sort of the exact opposite of Thanksgiving and Christmas, right?
Exactly. Yep. I've had mine removed. I know exactly what you're talking about. So how long have you been in the Pekin area?
So I was lucky to join Dr. Siebert in 2003. So we've had different affiliations over those years, and most recently with the Springfield Clinic as of August. Prior to that with Unity Point Health. Prior to that we were independent. So more or less the same services, just under a different umbrella.
Okay. And why do you like being a physician? What drives you?
I think medicine and specifically surgery has such an immediate gratification of being able to really make a difference in someone's life in a very short period of time. Especially things like appendicitis or bad gallbladder disease or, skin, breast cancer, colon cancer. You can really make an impact. I would be challenged if I had to help someone manage high blood pressure lifelong or even diabetes lifelong. But, appendicitis is beautiful. You take it out, you're done. And patients immediately feel better. So.
Yes. People like you when they wake up out of surgery.
Hero. Everyone else does the hard work, and you get to be the hero. So a little self-serving.
Exactly. Well, remind people, where can we find you at? And I know you're right there at Unity Point Hospital, but tell us where we can find you and how they can get a hold of you.
Sure. So when you enter the main doors of the hospital, we're immediately on your right, one flight up. So really easy to find and sort of conveniently located, and parking is simple, and really it's technically 600 South 13th Street, but it's right at the hospital. So if you know where the hospital is, that's we're in the building.
All right, Dr. Nani, thank you so much for joining us, and people are going to need to keep this interview on hand because I think after the holidays you're going to be getting some calls from some of our viewers out there. Dr. Nani, thank you so much for joining us today, and happy holidays.
Thank you. You too.
All right, we've got more coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.